we thought it would have been a good idea to compare these two different treatment strategies, complement inhibitors. So we went for Eculizumab, which is already available in Italy for commercial use. And then we compared that to Efgartigimod treated patients in Italy that is already available for commercial use. So when comparing treatments, of course, you have to think that this is real world evidence. It's not a randomized trial. We're not extracting data from huge registries. So we compared approximately 30 patients treated with one option and 30 patients with another option. What we found out is that patients were in general comparable between the two treatments in terms of demographics, except for age. So Eculizumab treated patients were slightly older, but the MG-ADL, the QMG score, multiple previous failures to IVIG, to PLEX, to non-steroidal immunosuppressant was quite similar between the two treatments. What we found out is that the response to both treatments at the MG-ADL was very similar, despite showing a slight advantage on Eculizumab, but that was not statistically significant. So both did very well. And also, a very interesting thing is that patients treated with Efgartigimod did well in the sense that they were very stable, despite being administered in a cyclical way, because the frequency of treatment cycles in our cohort was very high. We went for approximately 6 cycles per year. So by doing that, we had a very stable response. But then when we look at the QMG, which is the most objective scale that we have in myasthenia gravis, we found that Eculizumab treated patients had a better response. Response was deeper, was more sustained in time, and it got better and better after 5, 12, 24, 36 weeks, so that the gap became larger. And it was statistically significant, meaning that it's not just patients feeling better, you can measure that with an objective scale. Also, other two outputs from the study. One, the prednisone-sparing ability of Eculizumab was higher, meaning that with a complement inhibitor, with a chronic treatment, we were able to reduce steroid baseline dose in a better way with the Eculizumab compared to Efgartigimod. And the same was also true for MG deteriorations, MG crisis, and need for rescue medication. There was a higher effect of Eculizumab compared to Efgartigimod in the way it reduced these events during follow-up compared to the year before. And also treatment retention was very high. So patients stayed on therapy way longer with Eculizumab, so that 90% were still treated after 1 year compared to 60% with Efgartigimod.